Thank you, everyone, for attending. I will start off with Ari. It's all yours.
Good afternoon, everyone. First and foremost, thank you all for attending and making the time to see this amazing webinar that you are about to see. Also, I would like to thank Myrna, who is a holistic nutritionist and scientist who put this amazing presentation together with Dr. Tamika Burns. Today, we're going to be going through COVID-19 facts, safety, and resources. And then next week, I would like for all of you to join us as well as we're gonna go over the types of food that you can go ahead and eat to support your immune system. Again, thank you, Myrna, for putting all this together. And yeah, I hope you guys enjoy the webinar.
Okay, thank you, Ari. So we're gonna get started. For just a couple of housekeeping things. Everyone is on mute while I'm presenting. Ari will look at the chat. If you have any questions, you could write questions and comments in the chat area. Tamika is going to monitor the Q&A, and you can also put your questions in the Q&A. And at the end, I will open up the chat so we could answer any questions that you may have. So let's get started. Okay, so like I said, thank you guys for attending today, a holistic nutrition workshop on COVID-19. We're going to discuss some of the facts, some of the safety concerns, and resources. As Ari mentioned, my name is Myrna Tamal. I am a research scientist. I've been in science for over 25 years. I work in a biochemistry lab. I manage a biochemistry lab in a major cancer hospital in New York City. I'm also a holistic nutritionist and a health and wellness life coach. And due to my own personal experience and dealing with health conditions of family members, I decided I wanted to broaden my horizons and obtain my degree in holistic nutrition and complementary alternative medicine, and also as a health and wellness life coach. I feel by this way I can help give back to the community and through combining science and ancient healing knowledge, which is basically the principles of natural healing. First, do no harm, follow the healing power of nature, identify the causes, treat the whole person, not just the symptom, and to educate and also prevent certain diseases. With us today is one of my close friends and colleagues, Tamika Burns. She has a PhD in immunology, infectious disease, and microbiology. She helped me put this presentation together, so I just want to welcome her as well, and we'll get started. So what is COVID-19? As everyone know, we're in a pandemic and everything is COVID-19. So what exactly is COVID-19? There's a lot of confusion about it. I just wanted to give some background. So COVID-19 is a disease caused by coronaviruses. So coronaviruses are a large family of viruses that can cause illnesses in animals and humans. And corona means crown. That is, as you can see from the picture, those red spikes here are the crown features. And here, the yellow thing, this is why it's called a coronavirus. Now, in humans, there are several different types of coronaviruses which are known to cause respiratory infection, from the common cold to other diseases. The recent ones in history was the Middle East Respiratory Syndrome, MERS, and SARS of 2003. Now, COVID-19 is also SARS-CoV-2. That is the name of the virus. COVID-19 is the disease which is caused by SARS-CoV-2. So just for simplicity terms, throughout this presentation, We are referring to the virus as COVID-19. So the origins of coronaviruses. So this type of virus can infect mammals and many mammals and humans as well. Um, these viruses are known as zoonotic viruses, which means they can transmit from animals to human. As we can see, SARS was known to originate from a bat, which transit to a cat, then to humans. MRSA came from a bat to a camel, and then to humans. COVID-19, since it's a novel virus, it's unknown. There has been some speculation that originated from contaminated meat source from an endangered species of anteaters, but this is not confirmed. So how does COVID-19 compare to other viruses? When this first started out, people were thinking it might be similar to the flu. And as you can see from the diagram on the left, the flu virus is different than the COVID virus. The flu has several different types. That's why every year you'll have different vaccines for different strains, whereas the COVID virus is just one strand that we know of right now. Another big difference is the infection rate. Now, the seasonal flu will infect from 1 to 2 people. The SARS virus can infect it from 2 to 4 people. COVID-19 can infect from 1 to 4.5 or more people. So how is this more severe than the flu? A key difference is between the COVID-19 and the flu virus is the incubation time. The flu virus incubation time is 1 to 4 days, whereas COVID-19 is 1 to 14 days. There's a higher percentage of infection of COVID-19 over the flu. As you can see, the flu infects 8.3 to 20% of people, whereas COVID-19, the data shows is from 25 to 50% presently. And transmission is a higher rate, as I mentioned. The flu transmit 1 to maybe from 1 to 3, whereas COVID is from 1 to 2 or more. Another major difference, hospitalization. The flu, 2% of the population may be hospitalized for the flu virus, whereas COVID-19, it's 19%. And this number changes as we learn more and the pandemic continues. The other big difference is the fatality rate. The flu has a very low fatality rate, less than 0.1%, whereas COVID-19, the fatality rate is 1 to 3.4 or higher. So in terms of transmission, so how is COVID-19 transmitted? Now, it's spread from person to person. Data taken from the New England Journal of Medicine, research analysis was done to look at the surfaces and the spread of the virus. So it could spread with droplets, which people become infected through cough, sneezing, or talking. It is airborne for up to 3 hours in the air. And as you can see from this picture, this is a picture of Manhattan. If you could see the virus, this is a demonstration of what it may look like. So this is important to keep in mind. So if you are outside, the virus is present. You would not want to be out and about with the virus circulating all around you. So another thing is it is transmitted through a fecal matter. So it's important to wash your hands after using the restroom. In terms of surface transmission, this virus can stay on stainless steel up to three days, cardboard up to 24 hours, and plastic up to 2 to 3 days, and copper up to 4 hours. So just to give you overview of the pandemic, I know this is a lot to take in, a lot of numbers, but what this shows, this is taken from Johns Hopkins University. They have a real-time map. This was updated this morning as of 10:30. And currently we have 2.1 million people confirmed infected worldwide. And in the US, we have 600,000 people. So this is just to put things in perspective, showing that, you know, this virus is very virulent and it spreads quickly. This is new data, actually, again, taken this morning from the Johns Hopkins website, and this is worldwide, the number of new cases. So what I want to point your attention to is this green line. This green line, this is the 10 most affected countries in the world. The US, we saw this gradual increase. And then as of, I guess, April 10th or so, we started to plateau, but now you can see it's going down, but we are peaking a bit. So just to give some real-time data of stats of New York City. Now this is data taken from the Department of Health, the New York Department of Health website, which shows the rate of infection per 100,000 people based on the population of each borough. So what we see here, what you keep in mind, like per 100,000 people, you'll get maybe 1,600 people infected. But the big number here is Queens. They have the highest rate. And I know this number has increased over the days, but it just shows that per borough, the rate of infection. Now, this is stats for the Bronx, since a lot of our residents are in the Bronx. This is a good way of looking at the infection rate in your borough. And this is taken as of this morning, as I'm sorry, per zip code. So if you look at this, if you click this interactive map, if you click on the zip code, my zip code is 10469. And as of this morning, there's been over 1,800 cases. And based on the number of people tested, is 62% of positive tests. I wanted to also include some stats regarding New Jersey, our neighboring state. This is current as of this morning, and as you can see, their rate of infection is going up as well, and their cases are increasing. So all of this data is like, okay, so who is infected by this virus the most? This is just showing that this virus is basically, if it infects everyone, all age groups, well, it shows that people who are 65 and older have a higher percentage of risks of being infected. So you see people over 85, there's a 22% rate of infection. And keep going. I also wanted to give some stats regarding hospitalization. Now, this is the number. This was data from earlier this week. This might have changed, but just to emphasize that the older you are, the greater the risk for hospitalization. And I know you can't really see the graph too well, but the red arrow here shows that the older you are, the higher your risk of becoming hospitalized due to coronavirus. The green line here shows 85 people over 85 are the most people in the hospital. Let's see. Now, this is data taken from the CDC as well. And this is showing the percentage of New York City who test positive. Now, to explain this graph, you look at the green line. Right now, testing in the public health lab, 80% of cases are coming out positive. In all the tests done in New York City, 60% of the cases are positive. What we need to be is where these red arrows are. We need to be below the 40% of the public health labs, and we need to be below the 20% line for New York City testing. And I'm bringing this up because a lot of people are probably wondering, well, when will the social distancing end? When will we be out of quarantine? And this is just to give some perspective of where we are and where we need to be. Now, I wanted to discuss who are at risk. As I mentioned before, everyone is at risk. Data shows that the older you are, the higher your chances of becoming infected, but also people with serious underlying medical conditions or who have severe illness, such as chronic lung disease or severe asthma. People who are immunocompromised, cancer, HIV are good examples. People who are considered severely obese, which has a body mass over 40 or more. Individuals with diabetes, heart conditions, chronic kidney disease, liver disease. As I mentioned before, individuals 65 and older, or people living in nursing homes. So what are the symptoms? Originally, the early symptoms were a fever, a dry cough, and shortness of breath. New data shows other milder symptoms can include a headache, a cough, muscle pain, fever, tiredness, or in the latest symptoms are loss of taste and smell. And these symptoms may not occur immediately. The incubation time, as I mentioned before, is from 2 to 14 days. So you may be asymptomatic and develop symptoms later on. And then, okay, what do I do if I develop symptoms? Well, the first thing to do is this slide demonstrates severe symptoms. Trouble breathing, persistent pain and pressure in your chest, confusion. If you can't get out of bed, if you have blue lips or face, this means you are not getting enough oxygen. And if this occurs, you need to contact your physician and seek emergency care immediately. Also, I wanted to mention that based on the mild symptoms, it's important to contact your medical provider, your doctor, your physician first. When you first develop symptoms, do not go to the emergency room. And if you have mild symptoms, first seek medical attention. You could use telehealth or a phone call. And if you have severe conditions, then you will be advised to, go to the hospital. Next, we wanted to talk about some prevention. So the biggest thing right now is to stay home as much as you can. Only go out for essential needs, if it's to get groceries, or if you need to wash your clothes or do laundry, or if you are in a essential job in which you are required to go to work. As of yesterday, New York State requires everyone to wear a mask while going out in public, which means covering your mouth and your nose. As I said, also keep a safe distance, washing your hands often, cover your cough, and if you are sick, you need to call ahead. So I wanted to talk a little bit about masks. I know there is a shortage of masks and we are now required to wear masks. We can make homemade masks, but homemade masks should be multi-layered. You could use a bandana, a scarf, you could use different filters, but it should be multi-layer. And there are different sources in which you could find how to make homemade masks, but it's important to wear a mask correctly, which means it has to cover your entire face in terms of your nose and your mouth fully. It should be strapped behind your ears and secured and snug in in your face. This is important because there has been some cases that people are out wearing a mask, but they're not being worn correctly. And also keep in mind that this is for your protection as well as others, but you should not have a false sense of security with wearing a mask. Another thing in terms of prevention is stay home. And if you can, if you need to go out, you need to stay at least 6 feet apart from each other. Social distancing is important. As I mentioned, this virus is airborne and it does spread through droplets. So at least 6 feet is required. And another thing that's important is to wash your hands with soap and water. And I just wanted to spend some time on washing your hands because there's a magic number of 20 seconds. So you wet your hands, you add soap, but you need to wash your hands and thoroughly for 20 seconds, being that this virus has what you could say like an oil layer, and the soap that breaks apart the oil layer. So if you think about if you're washing, a greasy pan, you add detergent, it'll break apart the grease and clean the pan, but it won't happen immediately. It takes some time. So it takes a minimum of 20 seconds for the soap to break apart the oily layer of the virus. So 20 seconds is the magic number. I wanted to talk a little bit about prevention in the sense of social distancing and stopping the spread. Think of an analogy of a campfire. If you have a fire going and it starts to build, you add wood to it, and then the fire continues to grow. If you stop adding wood to the fire, then it will eventually go out. Similarly with the coronavirus, if it does not have a host to infect, eventually it will slow and it will dissipate. And humans are like pieces of firewood. The more fuel you give to the fire, the larger it will blaze. So that is why social distancing and following protocols extremely important. I know there's been some talk about flattening the curve. And what exactly does this mean? So if you look at the red bar, that is people who are becoming infected at a higher rate because this virus spreads and is virulent. The healthcare system is the dotted line there. That's the capacity that we have in our healthcare system to provide proper care and to control, the outbreak. Now, if we are above this line, we will overload the healthcare system and it will crumble, because if we destroy the healthcare system and the healthcare workers are exposed or more affected, then we will not have the capacity to care for those who are infected or who are in critical care. This is why flattening the curve is extremely important. And just to give you some stats for hospitalization in New York City, this is taken this morning as well, new data. Daily number of people admitted in New York City over, April 4th to April 13th. And as you can see, we had over maybe 600, 700 cases daily going in, and the number has been decreasing. But again, we need to be below this dotted line where this arrow is in order to have a more stable and a control system of handling this epidemic. I wanted to talk about some myths and facts. So there's been a lot of confusion, and I wanted to just clear up a few points. So they said everyone needs to get the flu shot. And will the flu shot protect you against COVID-19? The answer is no. The flu shot is for the flu virus. As I mentioned before, the flu and the COVID-19 are two different viruses. The flu shot will help you in terms of the flu season, but there is no vaccine or cure for COVID-19, so the flu shot will not protect you against COVID-19. Another thing people are saying, some people who have been released out of quarantine, they said they're no longer at risk to others. I mean, if people are following protocol and keeping a safe distance, then once you have the virus, you should not be at risk to others if you develop antibodies, but it's still important to maintain, protocol, safe distance, and so on and so forth. Another myth which was originating earlier was only the elderly people or people of Asian descent are truly at risk, and young and healthy people do not need to worry. As I showed you previously, this is not the case. Viruses, COVID-19, do not discriminate by age, race, or ethnicity, or anything else. Everyone can get sick from this virus. What it is the degree and the underlying condition which plays a part. Other things that there might be some confusion about is that the weather is getting warmer, it's spring, so the virus will disappear in warm weather. This is not the case because evidence show from the world data that COVID-19 is affected every continent, every type of climate, warm and hot climate. So the fact that it's becoming warmer doesn't mean the virus will disappear. It still transmits in warm weather. Just to reiterate, it says, if I start having a cough and I feel I have a fever, I need to go see my doctor. The answer is no. With mild symptoms, you need to contact your doctor, call ahead, stay home, isolate yourself. That's important. Isolate yourself and keep in contact with your doctor. And if things become more severe, then you could call your doctor and arrange to go in. Another myth was hand sanitizers, even homemade, work just as good. Now, I know we had a shortage of hand sanitizers and people are making their own. A key factor here is that if you make something at home, it has to have an alcohol content of at least 60% alcohol. And this is ethanol alcohol, not drinking alcohol or any other type of alcohol. So just keep that in mind. Moving on, I said, okay, so treatments. What is being done in the medical and science field? So currently there is no approved drug or treatment for COVID-19. Currently the main objective of the clinical management includes prevention and controlling the virus and supportive care for those who are infected. What we see is a lot of researchers in the community and globally, they are collaborating internationally, and they're sharing a lot of information in terms of like the structure of the virus. You need to understand what this virus looks like and figure out how to develop a cure or a treatment. And we see that going on globally. There's over more than 200 clinical trials occurring as we speak. Some of the therapeutic approaches that were in the works right now was some antiviral drugs, remdesivir, which is one experimental drug. There has been some trials going on. One of the companies, pharmaceutical companies, are looking at patients with COVID-19 in China to see how this drug will behave. Also, there's been talk of hydrochloroquine and chloroquine. Now, this is a drug for treatment of malaria. This is still being done, investigated, and this is a very toxic drug, and it does have severe side effects. So, I mean, this is one of the options, but it's not a cure. And right now, some of the other studies going on is taking the plasma from patients who have developed antibodies and see if we could use that to try to treat some of the more severe cases. That just means that people who recover from the virus, they have antibodies in their blood, and we could try to analyze that and see if we could use it as a resource. So speaking of resources, moving on, there are some resources for more information. There's a text COVID-19 for New York. There's also a hotline. There's a New York City Department of Health, and there for the Bronx, there is testing being done at certain locations, such as Bay Plaza Mall, Lehman College, Jacoby, Bronx Health, Bronx Lebanon, Montefiore, but you need to call ahead and make an appointment. You cannot just show up to get tested. And as things evolve, there are new testing sites and testing methods being developed. In terms of additional resources, there is the Employee Assistance Program for counseling as well. There's New York City Well that has access to free mental health services. Headspace, which is a meditation mindful app, is providing free service for all New Yorkers. There is the Aging Connect for older New Yorkers. If they need help, there's a number there. There's a number, Vet Connections, and also for students and youth in crisis. So these are some resources available. There are others as well. And then I know this is taking a hit, is an economic strain for a lot of people. Some people are out of jobs, and I wanted to see, at least give some options of what are some of the companies that are hiring. The link on the bottom shows, but there are some companies who are hiring, like Instacart, Amazon, CVS, Walmart, other pharmacies. They're looking for people as well. And some of the other big stores like Walmart and Lowe's are hiring. And then also some resources for New Jersey, our neighboring state. If you go to COVID-19.newjersey.gov, they have information similar to the data I showed for New York. They also have a general number, a medical 1-800 number, and a text number as well. Where are we now? So we're coming to the end of my presentation, and I just wanted to just leave you guys with the positive outlook. I know there's over 2 million people infected globally, but what we can keep in mind that people are recovering. As you can see, you know, there's over 500,000 people globally recovered, which is a good thing as well. And we also see, as I mentioned before, global scientific collaboration, which has not happened before, in terms of sharing data and working together to find a solution. And we also see some advances in telehealth. You know, a lot of doctors and professionals are switching to an online platform so they can provide their patients with care. We also see a lot of acts of generosity in terms of companies coming together. We have the fashion industry making masks. We have companies like GM making ventilators. We have, you know, beer companies making hand sanitizers. We see a lot of philanthropy donations, you know, celebrities like Ben Affleck, Oprah, Jay-Z, Bruno Mars, to name a few, working together, making donations, collaborating with organizations like Feeding America or America Food Fund. And also we see the planet is healing. You know, climate change has been a big issue in terms of our environment, as this graph here shows. As of January 2019, there's a lot of pollution over Wuhan, China, but where this epidemic started. But as you can see, it's February of this year, the atmosphere has cleared, and there's less air pollution, which is a good thing. We also see the waters clearing in France and Italy, and we see the wildlife returning, fish and swans coming back, which is also a positive thing. So the planet is starting to heal. And we also see a greater sense of community. We see people reconnecting with friends and family. So with that, I just wanted to keep things in perspective, that things are getting better. They will get better. It just takes some time, and it takes a collaborative effort. With that, I just wanted to say thank you for attending. I just wanted to give a special thank you to my friend Tamika Burns, who helped me put this presentation together. I wanted to thank Ari and Bronx House for sponsoring this event, and I just wanted to let you know about our upcoming workshop. This is one of a 4-part series. Next week, we will talk about how to support your immunity and what food you can eat that can help. With that, we are done. And if you have any questions, okay, go from there. Okay. Do we have any?
There was a question in regarding if there's like any additional testing sites, or would you have people just contact the list that you provided?
I would have people contact the list. As I say, you know, new test kits and new methods of testing are being done. There's new information coming out daily or weekly. Is there any other questions?
Paul has his hand risen.
No, my hand went over the my computer by mistake. I didn't mean to do that.
Okay. All right. So if there's no other questions, I hope to see you guys at our next webinar next Friday, which we're going to be talking about food and things. I see someone has their hand risen. Is that you, Paul?
Not anymore.
Okay. Okay, well, that concludes our webinar for today. As I said, thank you for attending. If you guys would like a copy of the presentation, I'd be more than willing to send it to you. Just send me an email.
Will do.
Okay.
Thank you very much.
Thank you. Take care.
Thank you, Myrna.
Thank you.